Welcome to the Liberal Arts Showcase. We're happy to have today Mike Cannito, Professor of Communicative Disorders at the University of Louisiana at Lafayette. Welcome to the program, Mike.
Well, thank you for having me.
So what drew you to Lafayette? You came to this university fairly late in your career. You've been here for 2.5 years. What drew you to our program?
Well, I had been at the University of Memphis for 21 years, and to be honest, I was getting bored with doing the same thing in the same place, you know, every day, year after year, and I wanted to change the pace. And I've always been very interested in this part of the country, Acadiana area. I did my master's degree in Beaumont, Texas, and there were a lot of Cajun folks over there, and I had friends and family there who were of the Cajun persuasion. And so I've thought about it, and when the position came open here at the University of Louisiana, I was very interested, and Dr. D'Amico contacted me and did some recruiting, and I came down and interviewed, and I was very pleased with what I saw here.
Were there some aspects of the program in speech pathology and audiology that attracted you?
Absolutely. The CODI program here at University of Louisiana has a very strong academic and clinical faculty with a lot of strength and expertise in a number of different areas. And I thought that would be a great experience to be able to work with other folks who were well known in the field, who had done a lot of research in these different areas of speech-language pathology.
Mm-hmm. Can you tell us a little bit about your research and how it fits into the rest of the department?
Yes. I work primarily with neurological disorders in adults, and my area is in what we call the motor speech area, where we're looking at the ability of patients with neurological disorders to be able to talk well and communicate through spoken language. And the process of speaking is incredibly complex and requires an interaction and coordination among 80 to 100 different muscles. And it happens very rapidly. Some of the most rapid movements that humans produce are speech movements. And so as you can imagine, if there are problems in different regions of the brain, this could easily result in impairments of that speaking process because of the complexity of the activity that has to go into controlling the vocal tract and the organs of speech production. And I'm also interested in the language aspects in neurological disorders, but in terms of my research, I primarily work in the speech area.
So speech is complex in terms of involving a lot of different muscles, but it's also complex in the sense that it is a complex mind-body interaction. It's a physical act, but it's also a complex mental act.
Absolutely.
Does that play out in how it's studied?
Yeah, we're interested in mental processing and in neurological processing that is involved in speech production. And in my own research, I'm currently looking at Parkinson's disease and treatments for speech and voice in Parkinson's disease.
How does Parkinson's affect speech and voice typically?
Well, in Parkinson's disease, there is a tendency for movements to become very slow and very small in amplitude due to the stiffness of the muscles that occurs in Parkinson's, the rigidity, and this results in inadequate movement, and speech becomes less intelligible. The vocal folds do not come together like they should. There's a gap usually, and this results in a very breathy type of voice pattern. So the patients talk very weakly and with a breathy voice. And all of these factors, both for the articulation in the oral cavity and for the production of voice in the larynx, they come together to affect intelligibility, reducing the extent to which Parkinson's patients can make themselves understood. And so I'm studying well, I had previously studied a particular voice treatment that was developed elsewhere called Lee Silverman voice treatment. It was developed by Dr. Lorraine Ramig and her colleagues in Boulder, Colorado several years ago. And I've done some work on that treatment, documenting the effects on intelligibility for that treatment. And
what does the treatment involve?
Speaking and phonating with greater effort.
Okay.
And they train the clients to speak to think loud and to speak loud, and just using this higher effort. And it takes a lot of intensive training, 4 days a week for 4 weeks, 1 hour session each time. It's pretty intensive, and it really does help them, the Parkinson's patients, with their speech and voice. And I was myself studying how it affected their intelligibility. So having done that research, I became involved with a collaboration with Dr. Shalini Narayana at the University of Tennessee Health Science Center in Memphis. This is before I came here. And we wrote a grant to the Michael J. Fox Foundation for Parkinson's research to study combining this behavioral voice treatment, known as LSVT, with transcranial magnetic stimulation, in which a clinical physiologist, Dr. Narayana, would stimulate the brain either at the left motor strip or the right motor strip to, what it does is it facilitates motor activity within the brain, and this can result in better motor learning. And this had been demonstrated for the training of finger movement sequences. And so we were interested in extending that to Parkinson's patients who are undergoing behavioral voice treatment to see if it will increase the rapidity with which they acquire their treatment goals on the one hand, and if it would have an effect on outcome on the other hand. Would they do better at the post-treatment point, and then at 3-month follow-up, would they do any better?
Right.
And so Dr. Narayana is doing this transcranial magnetic stimulation. We have clinicians in Memphis who do the voice, speech-language pathologists who do the voice treatment. And then my colleague, Dr. Narayana, is also obtaining functional magnetic resonance imaging scans, brain imaging, to look at any changes in the neural networks for motor function from pre to post treatment and at follow-up. So it's a really large and complex grant, and my role is to receive all of these speech recordings of Parkinson's patients, and I don't know who they are or which group they're in, or whether it's
That's
pre, post,
intentional.
or follow-up.
It's blind.
Right,
That's
yeah,
supposed to be blind for you.
Yeah, so we're doing all of the analyses of speech, including a wide variety of acoustical analyses in my lab, and also perceptual rating scale, psychometric rating scale studies of the quality of the voice and the degree of intelligibility impairment. And it's a big job.
Yeah.
And we're still working on it, and still running subjects, and the data's not in yet, so we can't really even say what the results are going to be, but we're optimistic that having this combined modality treatment will make something that worked for these patients work even better, is the intent there.
I understand there's something called the neural network theory of speech or speech disorders. And you mentioned that this was trying to stimulate the neural networks. What's the theory behind the treatment?
That by activating the motor cortex, because in Parkinson's disease the motor cortex activation is diminished significantly.
Okay.
We know this.
Yeah.
So that by sort of revving up the two motor strips, some patients are getting the left, some are getting the right, and the two hemispheres control different aspects of speech production and voice production.
I see.
The right hemisphere is more involved in prosody and intonation, tone of voice. The left hemisphere is more involved with articulation and those more rapid aspects of voice production and speech production. And so they actually have their own networks, but they do work in concert. And so, and then we have a sham condition in which the patient is getting TMS, but the magnetic pulse is turned down to such a low level that it's known that it could not be affecting the brain. So, and that condition is our proxy for the behavioral voice therapy alone.
I see.
So that's
To
our control
for that.
condition. So we can see if the
Yeah.
other two TMS conditions are making a difference in the outcome of the treatment.
And these roles of the two hemispheres in speech production, does that fit into the old understanding of the right side and left side of the brain having sort of globally different roles?
Yes.
The left side was more analytical and logical, and right side was more involved with emotions. Is that still currently believed? And,
Yeah,
and
I
do
would
those
say
roles
so,
fit in?
except I would say that we realize that they used to say speech is a left hemisphere function. And many aspects of speech are a left hemisphere function, but the two hemispheres have to work together to integrate the emotional aspects of voice production and even attitudinal and just intonation in general is which of course contributes to intelligibility. How we vary our voice over the course of an utterance, for example. And the two really do work in concert, and they're both contributing their own unique features to the production of speech.
So it really is a very complex act indeed.
It is, and being able to work with a brain imaging team like the one at the University of Tennessee Health Science Center is very exciting. So I'm glad I was able to bring a piece of that here with me to UL.
That's great. We are here with Mike Cannito, who is speaking about his research in speech pathology, and we'll come back in a few minutes. Join us. Welcome back to the College of Liberal Arts Showcase. We're here with Mike Cannito, Professor of Communicative Disorders here at the University of Louisiana at Lafayette. Welcome back, Mike. So you were telling us about your research in a variety of fields. Tell us about your lab here. Are there others involved? Do students get involved in the work here? How does it actually
Very much so.
take place?
In fact, I rely a lot on the students to help me with these analyses. I have a system called the computerized speech laboratory system that I also worked with in Memphis for many years. So I'm very familiar with it. And I was able to purchase one of these for the lab at University of Louisiana here. And it is really the gold standard, I would say, in acoustic analysis of speech. And my graduate assistants that are assigned to me, I have I have currently 4 master's students, 3 of whom are graduating.
Okay.
And then they all work with me on these analyses. I've trained them to be able to do what they need to do for speech acoustics. And then I have one doctoral student who's also working in the lab with me, and he's using a different set of software programs for his analyses. And in fact, he's studying intonation, which in the Parkinson's patients.
Okay.
Before and after this combined modality treatment. So yeah, the students are very integrally involved in the lab, and I don't feel like I could do it without them. So I'm going to have to train a new batch come fall. But
what is it that the equipment does?
well, it's a very high quality recording system that we record acoustically into it through a microphone, and then the equipment digitizes the speech sample, and we're able to then analyze it using a wide array of signal processing algorithms that are stored in this CSL system. And we can analyze speech in terms of its intensities, its frequencies, its durational aspects, and make a broad range of measures that tell us about various aspects of speech production in the patients that we're studying pre and post treatment. And so I'm trying to get the students really well-versed in making these kinds of measurements.
Right.
Because I think they'll be useful skills for them to have when they get out into the field, whether they're becoming clinicians or whether they are going to be academicians after completing a PhD.
So some of these students are actually going to be taking these practices out and treating patients using these methods and these results.
I would hope so, and that's the goal, yeah.
Great.
Yeah.
What kinds of courses do you teach?
I teach a variety of courses. I teach motor speech disorders, which, as I mentioned earlier, is involved with how the brain controls the rapid, complex movements for speech and voice production, and how these processes go awry following a variety of kinds of neurologic injuries or neurologic diseases, such as Parkinson's disease or stroke and so forth. And so there's a wide variety of disorders that can occur as a result of neurologic damage that affects speech, known as the dysarthrias, and I teach all of that spectrum of disorders. And then also there's a disorder called apraxia of speech that's mainly seen in stroke patients, but not exclusively, that it renders the patients unable to organize the movement patterns needed for speech. And at the most severe level, they are speechless. And we work with those individuals as well. So I'm teaching our graduate students in the master's program and in the doctoral program how to diagnose and also manage these conditions with clients who have these communicative disorders.
Right.
So that's my main course that I probably enjoy the most, but I enjoy all my courses. I teach a course on dementia, all different types of dementia, Alzheimer's being the most common, but there's dementia associated with Parkinson's disease and Huntington's disease and a wide variety of other conditions.
And that plays out in speech patterns?
Yes, although more so in language, but there are speech differences that are found in these patients too. So I do teach some language-oriented information and cognition also. Of course, dementia is a disorder of cognition, so and that really affects language greatly. And so other classes, I teach a course called Communication Science, which is basically a course on acoustic analysis of speech, which is the stuff I do in my lab. I'm doing an applied version of that, but I teach them basic speech acoustics and then applied speech acoustics at the graduate level in that course. And I teach a course called Neurolinguistics, in which we study normal and disordered processing of language from a neurophysiological orientation, reading chapters and articles about neuroimaging techniques and how the brain processes speech and language, both in non-disordered individuals and individuals that have communicative disorders. And we get into speech there. It's not just language strictly, because I think speech is an important part of language. It's movement in the service of language.
Right. It strikes me that there's a difference in some of the disorders that you've described. A stroke is a one-time event, hopefully a one-time event that a patient can sort of progressively recover from or make progress towards recovering earlier abilities, whereas Parkinson's and other diseases like that can be slow and progressive. So is it possible that sometimes you're just trying to slow down an inevitable decline in speech patterns, and can that be considered successful?
That's exactly right, in fact. So with a patient that has a stroke, you expect recovery. You're going to see recovery if the patient survives the stroke.
Yeah.
With Parkinson's and other disorders, as you say, that are progressive neurological diseases, you're really trying to slow down the progression and give the patient strategies that will help them to be able to talk or process language better in the long term and slow down that decline. And so we're really interested in both aspects of these progressions or outcome.
Right. So ultimately, what do you hope to impart to your students?
Well, I only teach graduate students, and I would like them to have a very strong skill set when our master students get out of our program and go forth and become practicing speech-language pathologists. I'd like them to have a very thorough grounding in the knowledge base of the profession, but I'd also like them to have skills both for doing treatment and for doing diagnostics and assessments, and know how to use technology as well in their work as speech pathologists. For my PhD students, I would like them to have the skills, in addition to thorough grounding in the knowledge base, I'd like them to have the skills they will need to be successful researchers in the profession when they get out. And not a lot of folks have these acoustic analysis skills. And I try to impart that to my students hands-on with one-on-one instruction in the laboratory.
But it's obviously important to moving our understanding forward, which in turn improves treatment options for people.
I agree, very much so.
So you'll be attending a voice conference, I understand, in Philadelphia
Yes.
soon. Tell us about that.
In a few weeks, yeah.
Okay.
Yeah, so it's the Voice Foundation Symposium on Care of the Professional Voice is the name of the conference. And the Voice Foundation is one of the premier organizations in the area of voice production and voice disorders, both for healthy individuals and for disabled individuals. And the conference has many presentations about working with professional singers and working with professional actors. And while I find all of that interesting, that's not the area that I'm in, but they do include voice disorders among the range of topics. So I always go up there as a representative from the disorders area and present research related to the kinds of things that I'm interested in. And I'll be giving 2 presentations, one of which will be about the neuroimaging research and the behavioral voice treatment for Parkinson's that I was mentioning earlier.
Fantastic. And you're a bluegrass musician in addition to these other skills and endeavors.
Yes.
How did you come about that interest?
I learned to play guitar when I was a teenager, many years ago. As I tell my students, back in the Neolithic period.
Right.
But I always continued to play with other musicians, and while I was living in Memphis, I discovered they had a large bluegrass society there in Memphis, and I got actively involved with that and got very exposed to bluegrass, and also through that to what we would call the roots of bluegrass, which is old-time music, basically dance music that goes back into the 1800s. And I learned a lot of old-timey tunes, and like both those 2 genres are a lot of fun for me to play, and I enjoy doing that.
And obviously Memphis is the mecca of that particular kind of music, but have you found Lafayette to be an interesting and hospitable musical environment?
I've been working hard and getting used to the new job, so I haven't really explored that much. But I've been to the festival Days Acadians and heard a lot of the Cajun music and there and elsewhere since I've been here, and I find that very interesting and enjoyable, and still looking for some folks to play music with.
Okay, well, maybe you can find some through this interview. We have been speaking about Mike Cannito's fascinating research in voice and speech disorders, and this has been the College of Liberal Arts Showcase at the University of Louisiana at Lafayette. Thank you very much, Mike.
Oh, it's been a pleasure. Thank you.